Do you know prostate cancer is the most common type of cancer in men? According to the American Cancer Society, it is estimated that about 1 in 8 men will be diagnosed with prostate cancer during their lifetime. This is a cancer that develops in the prostate gland, which is a small organ in the male reproductive system. The good news is that prostate cancer has one of the highest survival rates of all types of cancer, especially when found and treated early. However, most men ignore or they don't know the warning signs and symptoms of prostate cancer. In this video, we'll discuss signs and symptoms of prostate cancer that men should know so they can take the necessary steps to seek early treatment if needed. Hi, DrJedosaThePharmD here. Welcome and please like and subscribe to the channel. Prostate cancer often does not cause any symptoms in early stages. However, as the cancer grows, you may start to notice the signs and symptoms that we are about to discuss shortly. And I'm going to discuss the signs and symptoms by putting them into 3 groups. Number 1. Urinary symptoms. One of the most common signs and symptoms of prostate cancer is difficult urinating. This can include a weak urine flow, feeling like you have to pee or urinate a lot, especially at night, and difficulty starting or stopping the flow of urine. Other potential symptoms include pain and discomfort while urinating and blood in the urine. These symptoms can be a sign of prostate cancer because the prostate gland is located just below the bladder and surrounds the urethra, which is a tube that carries urine out of the body. When the prostate gland grows or becomes enlarged, it can put pressure on the urethra and cause urinary problems. But also keep in mind that prostate cancer is not the only condition that can cause these urinary symptoms. Other conditions such as an enlarged prostate, also known as benign prostatic hyperplasia, prostate infection, or a urinary tract infection can also cause similar symptoms. So that's why it's important to see a doctor if you experience these symptoms so that the cause can be properly diagnosed and treated. Number 2. Erectile dysfunction symptoms. A hard time getting or keeping an erection can be a sign of prostate cancer. The prostate gland is a part of male reproductive system and is responsible for producing fluid that is a part of the semen. So when the prostate gland grows, it can press on the nerves and blood vessels that are responsible for achieving and maintaining an erection. This can make it harder to get an erection, which can be a sign of prostate cancer. But also, it's important to remember that there are many other factors that can contribute to difficult getting an erection, such as stress, anxiety, diabetes, heart disease, obesity, and certain medications. Other symptoms of prostate cancer can include painful ejaculation and blood in your semen. Once again, I would like to remind you that these symptoms can be caused by other conditions other than prostate cancer. So it's important to be aware of these symptoms and talk to a healthcare provider if you experience any of them. Number 3. Lower extremity symptoms. There are a few lower extremity symptoms that can be associated with prostate cancer. These can include swelling in the legs or feet and stiffness or bone pain in your lower back, hips, pelvis, or thighs that does not go away. Bone pain is usually experienced by patients whose prostate cancer has spread to their bones, also known as metastatic prostate cancer. If you continue to have any of the signs and symptoms discussed above, you should let your doctor know so that they can give you the right diagnosis as well as recommendations for screening and prevention. Early diagnosis and treatment can help improve outcomes and survival rates. So you may be wondering, what tests are used to find out if you have prostate cancer? Well, There are few tests that can be used to find prostate cancer. One of the tests is called prostate-specific antigen PSA test. This test measures the level of a protein called PSA in your blood. PSA is made by the prostate gland, and high levels of PSA can be a sign of prostate cancer. But they can also be caused by other things like an enlarged prostate or prostatitis, which is an inflammation of the prostate. Another test is called a digital rectal exam, DRE. In this test, as the name implies, the doctor puts a finger into your rectum to feel any abnormalities in the prostate gland. Now let us switch gears and see who is at the risk of getting prostate cancer. Prostate cancer is most common in men over the age of 50, and the risk of developing prostate cancer increases as men get older. African American men have a high risk of getting prostate cancer than men of other racial or ethnic groups. Other risk factors of prostate cancer include having a family history of prostate cancer and being obese. In addition to these factors, some men are more likely to get prostate cancer due to a combination of genetic, environmental, poor diet, and lifestyle factors. But something to keep in mind is that there are many men who develop prostate cancer even though they do not have any known risk factors. Maintaining a healthy lifestyle, including following a healthy diet and getting regular exercise, may help lower the risk of prostate cancer and other health conditions. And also, some research suggests that a diet low in processed meats and dairy products may help reduce the risk of prostate cancer. And there you have it. If you want to learn more about prostate, make sure to watch the video in the top right corner. In this video, we discuss the top 4 exercises for your enlarged prostate. I will also leave a link in the description below. Thanks for watching. I hope you find this video helpful. And don't forget to like and subscribe to the channel for more health and wellness videos. Have a wonderful day. Bye.